And welcome back to our continued coverage of the telehealth and remote monitoring technology showcase here at the Rayburn Building in Washington, D.C., where we have the pleasure of joining us on our program, Scott Belcher. He's the Chief Executive Officer of the Telecommunications Industry Association. And Scott, welcome to the program.
Thanks, it's great to be here.
Thanks for being here. Of course, we're standing in the middle of a great event in the telehealth space. It's winding down now, but what's the importance of TIA hosting events like this?
So we had 4 members of Congress here. We had probably 400 people, and we've got 25 vendors showcasing their health IT technology. And so the ability to showcase that technology for congressional staffers and members, you can't put a price tag on that. Once you see the technology and what it's capable of doing, that energizes them to really want to try to advance legislation. We heard a number of members of Congress talk about this is one of the few areas where they can work in a bipartisan fashion to pass legislation, and we're very supportive of that. And so being able to bring technology to Congress is important, because it's hard to get members of Congress, it's hard to get the staffers out, and it's particularly hard to get them out to see 25 companies.
Scott, of course, we had 4 congressmen as keynote speakers at this event. What's the importance of that and them stepping forward and taking a leadership role in the telehealth space?
Well, it tells the companies that they care, and they do care. They've worked together in the past to pass bipartisan legislation. We need to take away the barriers to innovation and the barriers to deploying this type of technology. And when members are here and they can talk about it and show leadership, that's what it takes.
Now, of course, there's brinksmanship on many issues on Capitol Hill between Democrats and Republicans. Do you think in the telehealth space that that'll be reduced somewhat because of the human factor?
I do. I mean, so this is not about Obamacare. This is about providing information to doctors that they need in a real-time basis and protecting patients. And so this is the kind of thing that both Republicans and Democrats can get behind. And in fact, in last year they passed legislation that took $123 million out of a program that funded campaign conventions, and then it was the first increase to the NIH budget in a very long time, and it went towards this issue.
Of course, cybersecurity is an important topic and an important issue that cuts across in a number of ways in the technology space, but specifically in the telehealth space. Do you think security in telehealth, or the concern for security in telehealth, is heightened?
Well, so we're talking about very important personal information, and so it's of course heightened. And you don't want your personal information getting out of any type, but particularly your healthcare information. So I don't know that it's different than it is in other verticals or other areas, but I do think it's critically important. And as we make this data available to individuals, you've got to worry about how that data is going to be used. So it's my data, right? But if I start to share it on the internet, you can't. Once it's on the internet, once it's available, you can't control it. And so we don't want to legislatively control it, but we need to be very sensitive about that. We need to be very sensitive with patients as they get their data and how they use it, and they will need to protect their doctor-client privilege. And that's so that's some new territory we're going to have to explore.
The telehealth sector, Scott, as you know, is moving at a quick pace. Remote monitoring and one of those components in telehealth. Where do you see this space, this sector, let's say over the next 3 years?
So as I've gone to different technology shows around the country or around the world, quite frankly, in the last year, wearables is booming, and this is the sexy part of wearables. It's not about how many steps you take, but it's about getting your heart rate. It's about getting your blood pressure. It's about getting your sugar level. This changes people's lives, and that's what's so important about it. And it's only going to continue to increase, and it's only going to continue to get better.
Scott, thanks for hosting this event, and thanks for your time.
Great, thank you.